obesity. In Oklahoma, by the last numbers from the Centers for Disease Control and Prevention, 31.1% of adults in Oklahoma were obese. Since 1988, the obesity rate in Oklahoma has nearly quadrupled. So today we're here to talk about not only the problems that our state faces, but also the solutions. And joining me today is Gary Lankford from the Association of American Indian Physicians, Christina Shay, who's a professor at the University of Oklahoma in Biostatistics and Epidemiology, and Amber England, the director of the Oklahoma Fit Kids Coalition. Thank you for joining me.
Thanks for having us.
Thank you for having me, Jaclyn.
So I was hoping that each of you could just kind of start out laying some of the groundwork for people watching to better understand the problem that we're facing here in Oklahoma. Amber, if you could start out, I know you know quite a bit about childhood obesity. If you could kind of give us an idea of the scope of the problem here in Oklahoma and what your organization does to combat that.
Sure. What we know about childhood obesity in Oklahoma is that 1 in 3 children in Oklahoma are either overweight or obese. We rank 48th in overall health, and we are last in fruit and vegetable consumption here in the state. And what the Fit Kids Coalition does is raise awareness about the importance of policy directly related to childhood obesity and take action on that policy, and also try to implement the policy once that it has actually been signed into law. And we've been doing that since 2003. We are a statewide initiative of the Oklahoma Institute for Child Advocacy.
Fantastic, thank you. And Gary, I was hoping you could give us an idea about, I know that there's a huge impact on the American Indian community here in Oklahoma, not only in regards to obesity, but also diabetes. If you could give us an idea of what the numbers are on that, and also what your organization does to combat that.
Sure. Excuse me, sure. Well, my organization is the Association of American Indian Physicians. We've had a grant for the past 2 years that came to us from the American Recovery and Reinvestment Act. And we were funded under that grant to work with American Indian communities to try and combat obesity through policy and environmental change. So that's what we've been doing for the past couple of years. If you want me to describe policy and environmental change a little more deeply, I can do that. Basically, going off what Amber said, it's a pretty big problem in American Indian tribes and communities, as it is across the country. Our statistics show that, for example, from the Office of Minority Health, American Indian Alaska Natives are 70% more likely to be obese than non-Hispanic whites. 1 in 3 children in United States and in Oklahoma, I think the percentages actually are a little bit higher when it comes to American Indian Alaska Native children. But big problem. I think everybody knows that it's getting. That's why we call it an epidemic, I suppose. But getting more so as time goes by, and so we're here to try and help our American Indian communities to combat it through policy change and environmental change.
Thank you. And Chris, could you give us an idea? One thing that that a lot of times gets not talked about as much is the cost that obesity and other health factors have on the state. I know that there's an estimation out there that obesity costs Oklahoma more than $854 million each year. I'm sure it's bigger than that. We could probably all agree on that. If you could give us an idea of the cost and the impact of obesity and other health indicators in Oklahoma.
Sure. Sometimes it's difficult, I think, for for the average person to understand the cost of obesity, because one of the difficulties in controlling obesity is that people don't see necessarily today the economic or even the health impact on themselves that will occur down the line. So taking a step back from the actual cost, what causes the cost? Well, obesity itself very rarely causes any, itself is the cause of a healthcare cost. But what obesity does cause is it's the number one risk factor, one of the number one risk factors close to smoking for the development of cardiovascular disease. And people who have people who are overweight based on their BMI, a recent study of over 89 different investigations combined all the data and showed that people who were overweight were over 12 times more likely to have diabetes compared to those individuals who were normal weight. So if you think about obesity itself putting you at a higher risk for developing these very expensive diseases, the cost on a per person basis can be staggering. So I'll give you an idea. A recent report from the U.S. Health Foundation, American Public Health Association, and Partners in Prevention, these three organizations came together recently and just did a current estimate of, in Oklahoma itself, the current estimate in 2008 of what people spent, what cost per person. So some of us might not pay anything, so if you consider that, but then some people are paying quite a bit. The average cost was about $1,069 per person in the state, directly attributable to the health costs associated with obesity. Now, they also did some modeling. They did some statistical analyses, and everybody knows that obesity is on the rise. So people tend to be gaining more weight and becoming more and more obese. So they did some modeling, and we're talking about the cost today being staggering over $1,000 per person. But when you in Oklahoma, but when you look and do future estimates based on where things are going, they had a pretty staggering statistic that cost per person in the year 2018, which isn't that far off, will elevate from $1,000 per person to over $5,000 per person in Oklahoma. And when you look at this report gives a per state breakdown. When you look at the other states, Oklahoma, if the trends continue, that $5,000 amount per person is going to be the highest amount in the nation. So obesity is not only personal health detriment, it also causes financial detriment. So when everybody can kind of think about what a dollar is worth to them, $5,000 or more per year in healthcare costs, whether it comes from an individual's pocket or in public assistance through insurance, that can really cut into the state's budget and through the budgets of ourselves and our lawmakers.
Wow, that's a huge number, especially when you think about the fact that we have 3.8 million people here in the state. That's a big number when you do the math. One thing that I'd like to put in perspective for people is, how we got here. We have quite a few poor health indicators, and why I don't want to focus on all the negative, I do want to talk about, how we got to where we are today. If you look at, numbers, like I said, in the opening, our obesity rate among adults has quadrupled since 1988. And so I was just hoping, and if you want to start, Amber, and we'll just go down the line, of how we got to where we are, and and if you know anything about what other states are doing as well.
I think obesity is a really complex issue. And so there are so many factors that lead to our high obesity rates in Oklahoma. Poverty is a huge factor. Oklahomans face real barriers when they're trying to make choices, healthy choices. And so a lot of the work that needs to be done is helping to remove those barriers so that Oklahomans can make healthier choices, and that those choices are easier on Oklahomans. So poverty is a huge factor in that. Access to health care is a huge factor in our obesity rates in Oklahoma. So, I think if you look across the country, you can see a lot of cutting edge research being done, particularly when it comes to children. A new groundbreaking study coming out about the importance of academic success and how that's intimately linked with obesity. And if you can, if active children become if inactive children become more active, they actually can increase their reading and math scores by an entire letter grade. So, I think that we have a lot of work to do when it comes to obesity, but obviously in the state of Oklahoma, cultural issues and the high rate of poverty certainly is a huge factor in reasons why we have such high numbers in our state.
And Christina, you talked about costs earlier, and obviously how these costs are increases. What are some of the reasons behind those increasing costs and how we've gotten to $1,000 per person in 2008?
Well, I think there is a combination of the increasing costs of healthcare dollars themselves, because if you look across the different states, we aren't necessarily the highest in healthcare costs in all of the states, but we have the highest rates of obesity. But when you look dollar per dollar, we're a less expensive state to get healthcare in compared to other states. So New Jersey might not have as high of healthcare costs related to obesity, but they cost a lot more. So there's a little bit of inflation healthcare cost question state to state. But one of the main factors when it comes to why obesity has been rising and how that's reflecting into healthcare costs. I think over the last few decades itself, and even earlier than that, our environment has become more and more catered towards reducing the amount of energy that we expend. So I always joke to myself that I get upset when I can't find the remote, and then I remember that I just have to walk across the room to push the button. So when it comes to, people, and just moving here to Oklahoma from other cities that I've lived, it's very easy to park 5 feet from the door, walk right into my office, walk 5 feet back to my car, and then drive home, and never having to expend that much energy. So I think some of it's a catering environment towards not being more active. And the other attributes, I think, are really the food supply itself. There's been an increase in the availability of food. There's food everywhere all the time. Access, convenience, driving home. You don't even have to get out of your car anymore to just swing by someplace and pick up food. And the food that we're consuming, the same serving size or the same item 10 years ago, 20 years ago, had less energy in it, had less calories, because the things we're using to flavor our foods, to put nutrients into our foods, it's increasing the actual amount of calories. So that terrible detriment. So if you think weight balance means you burn off the same amount of energy that you take in, and if that's equal at the end of the day, you maintain the same amount of body weight. If everyone is shifting towards having less physical activity because the environment caters to it, and the food that we actually eat has higher amounts of energy in it, there's no surprise at all. Well, everyone, just about everyone, is moving in that increasing direction when it comes to body weight.
Thank you. And I just want to cut in really fast and say, if you're just joining us, my name is Jaclyn Cosgrove. I'm the healthcare and medical reporter at the Oklahoman. We're currently hosting a hangout about obesity in Oklahoma, and we're waiting on Gary Lankford. If you want to kind of address like what we're talking about, just how you've seen obesity develop as a trend in the American Indian community here in Oklahoma, and just how you think we got to where we are today.
Sure. Well, again, what Amber and Chris have already said is kind of holds true for the American Indian communities as well. But we see people that a lot of us, for example, are working office jobs. We're sitting down all day long for 8 hours a day. Fast food, which we know is not good for us, is so readily available. But we also see people that live in rural communities, especially when we're talking about the American Indian population. And they live in many cases, they live in what we call food deserts, which means that there's not a grocery store, for example, nearby that's going to offer them fresh produce, fresh fruit. They might have to drive an hour. It might even be worse. We here at my organization, we work with some communities in rural Alaska, for example, and it's longer than an hour to drive somewhere just to find fresh fruits and vegetables in a store. And a lot of times, if you don't have that, what you do have is a convenience store that doesn't carry fresh fruits and vegetables, but they do offer a lot of food that's bad for you, a lot of food that's high in sugar, high in sodium, high in fat. So all those things, I think, combine to make the obesity rate what it is. But I think that what Amber was saying about socioeconomic status is a big one as well. People just, sometimes the healthier options cost more. And if people don't have the money or don't have health care, and maybe they aren't getting the education, they might go for something that's easy because we have busy lives and we have children to take care of. And it's much easier to go and get something that's fast, even though it may not be healthy, than it is to drive an hour somewhere if you don't have a local community garden or a local grocery store and buy fresh produce.
And I just want to remind anybody who's watching that you can comment on the right side of the window, and we are looking at those questions, and I think we should get to those questions. And one thing you mentioned, Gary, was actually a question that someone had asked about why is it so much cheaper to eat healthy? Someone said that it seems to be a way of perpetuating obesity. I think I've seen a lot of arguments on that, on whether it actually is cheaper to eat healthier, and I don't know if you would like to address that as well.
Well, I think that over time, hopefully we're seeing the costs of healthier food go down. But when you compare it side by side at a grocery store, for example, you'll see that these foods that are not necessarily good for us are usually across the board cheaper. The other thing is that a lot of people, one of the things that we try to train people to do is maybe to look at the back of these products now that the nutritional information is there. But a lot of people still don't do that. So if you were to compare products, not based on price necessarily, but based on their nutritional value, it would, I think, really be an eye-opener for a lot of people. And there are people out there that have lost a lot of weight in their lives just from looking at those nutritional values and taking into consideration higher fats versus lower fat foods, even if it might cost a little bit more to go healthy. But I'm hoping and hopeful that over time, with obesity becoming the issue that it is, that cost will, if not go down, maybe they could at least find a medium where they're somewhat equal to the foods that are out there that are not as healthy for us.
You know, one of our commenters actually commented that there aren't coupons for fruits and vegetables, which I think is interesting to point out.
Right. Right.
Amber, there's a question from one of our viewers, and I think it'd be great for you to answer. They said, in regard to children who are obese, what's your opinion on how educators, state workers, or local leaders should approach parents of these children in order to help their children become healthy again?
I think it's really important when you're dealing with children, especially who are overweight or obese, that we have to be careful in the way that we approach them, because so much of their emotional health could be tied to the way we address this issue with them. And so educating parents about teaching their children that it's not about weight, but it's about health. And so you certainly don't want to, tell your child, you're so fat. That's not, make it about health. And I think it's important to make it a family affair. So if a child is struggling with weight, don't just put the child on a diet, but actually, get the whole entire family involved, so that the child isn't singled out or felt some sort of shame because of their weight. Because oftentimes, children don't have a lot of choice in what's put in front of them in terms of, what they eat or where they live. And so I think explaining to parents that it needs to be dealt with delicately, but that it's not a matter of weight, but it's a matter of overall health. And we're going to go outside after dinner tonight and walk for 30 minutes because we want to spend quality time together as a family. Or, make it fun, make it an activity where you're in the kitchen learning how to make a new fruit or vegetable. Anything that you can do to make it about health and less about weight is always going to be important. And talking to parents about that is extremely important from educators' perspective and from the health community as well.
Absolutely. Chris, just to follow up on kind of the topic at hand, what are some of the risk factors that children are obese are susceptible to as they grow older?
Well, that's a great question. That's a line of work that I've been doing recently with the American Heart Association. And the American Heart Association has recently defined a definition of cardiovascular health, and in that is 7 components, including lifestyle factors, diet and physical activity, as well as the traditional risk factors you'd think of, blood glucose, blood pressure, cholesterol. So there's a lot of evidence to show that although we generally think of children as being healthy, there's evidence to show that coronary artery disease and the disease that starts the blockage of the arteries that eventually leads to heart attacks can start in the single-digit years in very early childhood. The sad part is that the majority of kids are all born in a state of cardiovascular health, unless there is a congenital disease or there's something that they're actually born with that's not lifestyle related. If those things are taken out of the equation, most kids are born with cardiovascular health in an ideal state, but it's through lifestyle and mainly diet, physical activity, exposure to tobacco, that really can develop cardiovascular risk as early as single-digit years. A recent publication that's under review right now, we're seeing nearly 50% of kids under the age of people less than 20, the government agencies consider children adults less than 20 to be children or adolescents. So less than half in certain groups are maintaining regular amounts of physical activity that are recommended. And the vast majority, greater than 90% of kids, have a diet that is not considered ideal when it comes to reducing the risk of developing cardiovascular disease. Concepts like lower amounts of sodium, fruits and vegetables. They also support fish and sugar-sweetened beverage consumption, low sugar-sweetened beverage consumption. But we're looking at low levels of physical activity, very poor diets, and that's already in single digits, translating into elevated elevated glucose, elevated blood pressure, elevated total cholesterol. So if these risk factors for cardiovascular disease are developing younger and younger, there's a thought and a hypothesis that's being generated that children of this generation may actually develop cardiovascular disease at earlier rates and earlier ages than their generation before them. So this may be the first generation of kids that potentially die earlier or have a greater mortality rate compared to their parents in relationship to cardiovascular disease, and a large amount of it's driven through obesity as a result of poor amounts of physical activity and bad diets.
Wow. That's pretty startling what you've just said. I mean, I've heard many people talk about how, usually you have generations that are getting healthier and healthier, and ours isn't necessarily the case. Gary, I want to ask you, if I'm a parent in Oklahoma and I belong to a tribe, what resources are available to me and my family, maybe at one of the Indian clinics or just in my local community through Indian Health Services, or maybe your organization, that I can help my kids and I get on the right track and live a healthier lifestyle?
Well, just to kind of piggyback on what Amber was saying, one of the things that we see is if parents don't eat healthy or exercise, then their children are not going to do that either. There is a big reliance on family, and exercising and eating healthy together is something that a family should do if you have a child that may be on the way to being obese. But there are, of course, resources out there. My organization, for example, is working on a media toolkit that's geared specifically towards American Indian tribes and communities across the nation. And we've got a set of 4 videos, some posters and flyers and things that we're putting together as a toolkit that's going to be available on our website. Also, we can mail those toolkits out to people working on the printing of those right now. Indian Health Service is another a good resource to have. Any kind of clinic really is, these days, with obesity becoming the problem that it is, they're going to have information on how to eat healthier, ways to exercise, and how to talk to your children about eating healthy and try to get them on board with actually being healthy, so that the next generation is healthier than we are right now. And I think that with obesity becoming the problem that it is, we're seeing more messaging getting out there in regards to eating healthy and physical activity, because those are the 2 big things that you can do in your own life to curb this epidemic and change your own health and change the way that your family lives. Just to eat healthy and try to get more exercise. And if you have a support system within your family or within your friends or your community, then that makes it that much better. And people tend to be even more successful when they have support.
If you're just joining us, my name is Jaclyn Cosgrove. I'm the healthcare and medical reporter at the Oklahoman. We're having a hangout about obesity in Oklahoma. Our guests are Gary Lankford of the Association of American Indian Physicians, Chris Shay, a professor of epidemiology and biostatistics at the University of Oklahoma, and Amber England, the director of the Oklahoma Fit Kids Coalition. We have a question that it was brought up in our chat. You have sometimes you'll see people get breaks for, if they're not a smoker, they get paid less on their health insurance. This person has asked a question about punitive actions like a fat tax that charges people who are obese more due to their strain on the healthcare system. And someone earlier asked about what you guys' opinions on, best practices are that the state of Oklahoma could be doing. So maybe if you could comment on things like this, I don't know a better name to call it than a fat tax, but I'm sure there is a better one. So if you could just kind of touch on that. Amber, if you want to start.
Sure. I don't think anyone in the Oklahoma legislature really has an appetite to raise taxes. In fact, I think that there's a big push at the state legislature to lower taxes. So I'm not sure we'll ever have to worry about a tax increase around obesity or any kind of soda tax going forward. Those balloons have been floated out there before and they just didn't fly. I think that more importantly, it's about educating Oklahomans about how to make healthier choices and also removing barriers that Oklahomans face right now. The Fit Kids Coalition joined forces this last year with the American Heart Association to work on shared use legislation, and what that did, and it goes into effect November 1st. And that piece of legislation worked on liability issues, creating a little bit of liability protection for schools who open their facilities after hours for recreational purposes for families across the state. We know that, every community has a school, but they may not have a gym, and they may not have, sidewalks in their neighborhoods or shoulders on their highways in rural Oklahoma. But every community has a school, and those schools are funded by taxpayer dollars, and those can be used to really create a community hub in each town in Oklahoma, so that families are coming together and getting healthy together, and we're not having punitive damages, because I don't think anytime you shame someone or put punitive damages on someone, that's going to make them change their behavior. But it's about creating a culture around the state that values health and removing barriers to healthy choices.
And Chris, if you just want to go next on that.
Sure. Another point I'll throw out there, I definitely agree with those comments regarding personal responsibility and education. Another concept to throw out there when we're talking about things that, when we think about things that load the gun, so to speak, about what is the most likely culprit or the stronger influence on obesity, if you're looking at the differences between physical activity and diet, of course, it is very important for your health to maintain regular amounts of physical activity. But if you walk on a treadmill for 30 minutes or run on a treadmill for 30 minutes, you may only expend 300-400 calories. The way the food supply has been set up, the way that I mentioned that the food has become increasingly higher in calories, it's much easier to take in much more than 400 calories in a 15-minute sitting than it is. It's easier to take in the calories than it is to burn them off. So when you're talking about what loads the gun, diet, in a way, can load the gun with a much bigger explosion when it comes to obesity than physical activity, although we need physical activity to maintain optimal health. But having said that, there's been some really interesting research that's been done recently that has shown which types of policy interventions with regard to diet have the most influence on healthy nutritional choices that people make. They basically compared two types of policies: information measures, which give the public more information, education, and an opportunity to learn about their nutritional choices. And the second one measures the targeting to the marketing environment. Do you change what's actually in the food supply? And although we all would like to hope that everyone makes the best decisions for themselves and their family, sometimes either that choice isn't made or people don't know what the correct choice is. So they concluded that a lot of the educationally based interventions are not as successful as when the actual food supply itself changes. So what that's translated to in other parts of the world, for example, in the United Kingdom, they had implemented into their food system and their food manufacturers, they mandated that the salt reduction be reduced over a set amount of time. They showed that people don't notice the difference, and they had to do it by a certain amount of time. And they showed that with doing this reduction over a 7 to 10 year period, they actually reduced the amount of sodium that the population is taking in. It was actually effective. So if I think as a culture and as a country, we can take that same approach with identifying the things that are harmful or the most harmful in our food supply and make appropriate changes so that it takes the decisions out of the parents' hands, at least a little bit. You know, if you have two frozen drinks in front of you, hopefully there isn't one that's 500 calories and one that's 1,600 calories, like is available at some fast food restaurants. So if you have a little more equalization in the amount of energy in the food system and the nutrients, hopefully that's another approach that we can all take together.
And Gary, what would you say would be best practices? And what are some of the best practices you're seeing used among American Indian communities across the U.S.?
Well, we tend to focus a lot on education, just to let people know that it's a lot easier to get started on an exercise program than they might think, and that it just takes small steps really to get you to where you really want to be, and you just try to increase your activity over time. The other thing that we've done with the grant that we've had for the past 2 years is try to create more permanent and sustainable change through policy creation. So, for example, we might work with the tribe to create a policy that will increase physical activity in a local school. or we might work with a tribe to create a policy that will remove the unhealthy and sugar-sweetened beverages from vending machines in a local school. And those are small things that you can do, but over time they make big differences in communities, especially if you can engage the community and get them on board with you. The other thing we like to talk about in my organization is environmental change. So we have in the past helped American Indian tribes to, for example, put in a running path or a walking trail and make it safer for people, or maybe just enhance a walking trail with lighting and signage to make it safer and more accessible for people so that they're more likely to do those things. Sometimes we see in tribal communities people don't feel that safe because there might be, for example, we hear a lot of people that told us that, well, there are dogs running loose, for example, on our reservation, or there's no lighting at the trail, or we don't even have a trail. And so we try to encourage communities like that to put in a walking trail or get some funding, maybe just a small amount of funding to put lighting in and signage around a walking trail so that it's safer and people are more likely to use it. The other thing, I think, going off what Amber was saying is we have also worked with some tribes to create what we call joint use agreements, which is where you work with a local school so that you make their playground equipment in their recess area available to families after the school day is over. And those are things that a lot of people get, I think, discouraged by the fact that, well, I don't want to create a policy. I don't even know how to begin to create a policy. But you can partner with organizations and partner with people that might have that kind of knowledge, or come to us here at AAIP. We'd be more than happy to help people to create policies that will create that kind of lasting, healthy, sustainable change that will carry on for generations.
Okay, we're just about done with our Hangout. I'm going to give you guys one more chance to kind of wrap up your comments, and I don't want anybody to end the chat and go, oh gosh, I wish I would have said that. So Amber, do you have anything else you want to add that maybe we haven't talked about, or just something you want to touch upon before we head out of here?
No, I think we covered quite a bit of ground today. I think it's just important, again, to really look at this issue as a pretty complex issue, and that it's not going to change overnight. And it's going to take an entire state and communities from all over our state working together to really come up with solutions that's best for that community and that's best for our state. We've got tons of things going on. Fit Kids coalitions, joining forces with Heart Association and other organizations across the state. We have a lot of tools on our website. We blog a lot. We offer information whenever we can. So we're trying to really be the conversation starter around the state, and we just really appreciate you giving us this opportunity to talk about this really important issue.
And Chris, anything else you would like to add?
No, I'll second the appreciation for letting us talk today and get into this issue. I will throw out a quick bit of information for anyone that's interested. If you would like to check out the American Heart Association's website, they have a great tool called mylifecheck.org, and the website is www.mylifecheck.org. And you can go on there and enter a few statistics about your health, and it'll give you kind of a score. It'll show you the areas that you're doing great in, some areas that might need a little work, and as well as some suggestions on how to make some of those changes, whether it's physical activity, diet, your blood pressure, blood glucose, whatever it is. So information, I think, is the key and a great starting point, informing yourself on what you're actually putting into your body, what physical activity that you need, and actually making it a priority. I think that's going to be an important first step for most Oklahomans.
Gary, any last bit of information from you?
Well, I just wanted to say thanks for having me, and also that it is going to take time to make changes. Obesity is one of these issues that we've kind of grown into, pardon that pun, over time. We've just seen it exploding. So it is going to take time to change, but I think people don't realize that small changes really can get you where you want to be. And if you just make changes in your own family, that can have really lasting effects amongst other people that in the community that might see those changes and might make those same changes. My organization works specifically with American Indian Alaska Native tribes. So if you're out there and you're in a tribal community or on a reservation and you'd like information about it, or maybe like to get one of the obesity prevention toolkits that we have out there with our videos and posters, just visit aaip.org, or you can get in touch with me. My email address is on the site. And thanks for the opportunity to talk about it.
Sure, and if you three want to join, we're still having a kind of a bit of a conversation on our websites where a few questions weren't answered just yet. So if you three have time, if you could go talk to those folks, I'm sure they'd appreciate it. And we appreciate everybody who took time to watch this obesity hangout today. I'm sure we'll have many more discussions just like this. It's important to have conversations like this to find solutions in the state of Oklahoma. And we just want to thank you for joining us and thank our panelists for coming along.